Okay, we're going to be talking about RadPath correlation. So what is RadPath? It's correlating imaging to gross pathology and histopath findings. It's a great way to learn both radiology and pathology, but we'll mainly be focusing on the radiology, and it is fun. So let me give you a quick example. This is a patient who's going to get a transbronchial biopsy. So we look at the x-ray first, and hopefully you see a left hilar mass there, better seen on the CT scan, looks solid. Tissue's the issue. They're going to go in, get a sample. This is what we look under the microscope, some abnormal cells. This ends up being small cell carcinoma, very good for a large central tumor. So no one in medical school has taught you to think like a radiologist to this point. So I encourage you to check out our video / TikTok from July 8th on the Hartman 6 pathologies and our YouTube channel, RadPath channel, where we have a lot of good info. So here's a quick overview. We are made of a bunch of tubes. 1 to 6 bad things can happen to the tube. You can have an ingrowth, an outpouching, a narrowing, a dilation, a thickening, or a displacement. Let's see some examples. So this is a view of the bladder after contrast was given, and we will see an irregular filling defect on the left. Right there. Come up with the differential, but very suspicious for bladder cancer. Realize not all bladder cancers are made equal, so we'll have to look under the microscope and at it grossly. So we've got some leukoplakia, and then we have squamous cell carcinoma. Take this to the bank for boards. Schistosomiasis goes with squamous cell carcinoma. Okay, another patient with hematuria, this time a CT scan, non-con, con, and we will show it in the coronal plane. Hopefully you see the solid mass. It goes for a nephrectomy, solid mass there, and nice overlay, and this ends up being a rare form of RCC. Okay, 47-year-old with dysphagia. Start out with the chest x-ray. Hopefully you see this abnormal mediastinal contour there. What could that be? Let's give them some barium. Fill up the esophagus. This is after 2 minutes. Only a little bit has made it through. We got bird's beak narrowing there and then dilation upstream. This is achalasia. And it explains, our dilated esophagus explains that chest x-ray finding. Okay, let's end up with a neuro case. Chief complaint, losing my vision, headache, 81-year-old female, gets an MRI, and we will have a ring-enhancing lesion on the left. Great thing about radiology is the mnemonics. Magical doctor for ring-enhancing lesions. We'll have metzylymphoma on there, every Hartman differential metzylymphoma, but we'll also have GBM. And realize the prognosis, the treatment will be extremely different depending on what it ends up being. That's why tissue is the issue. You need to get a sample. Imaging is so important for planning the biopsy. Going in with the neurosurgeons, measuring twice, going in, getting their sample. And this is a case my med student got to go in and watch. And then under the microscope for the frozen and abnormal cells, this ends up being a GBM. Bad news. Okay, this crash course introduction to our RadPath course, but you can see the comments extremely positive, and the best comment you can give me is, I liked it so much I switched into radiology. So follow our page, watch the TikToks, learn some radiology, have fun.